In this video, we will be discussing about adrenaline. Adrenaline is also known as epinephrine. To begin with, what is adrenaline? Adrenaline is an endogenous peptide, endogenous catecholamine, endogenous catecholamine, which acts on alpha and beta adrenergic receptors. What is the mechanism of action? This is the first point to be discussed. It acts on alpha 1, beta 1, and beta 2 receptors. On alpha 1, it will cause vasoconstriction. By stimulating beta 1, it will cause tachycardia or increase in heart rate. And on acting beta 2, it will cause vasodilation. And it can also cause bronchodilation. These are very important effects of adrenaline. It has a dose dependent action also. Dose dependent action. If we give low dose, it will stimulate beta more. Beta means beta 1 and beta 2 more. If beta is stimulated, it will cause increase in heart rate as well as increased contractility. Means force of contraction. If force of contraction is increased by the stimulation of beta 1 receptors, it will cause increase in systolic BP. And if we give high dose, it will stimulate alpha 1 much more than beta. And alpha 1 will cause vasoconstriction. And vasoconstriction will cause increase in diastolic BP. Right. So this is about the mechanism of action. Now, second point to be discussed is route of administration. It can be given, it can be given IV, IM, subcutaneous, or endotracheal. We have to remember the routes very importantly because in different emergency conditions, different route is used for the administration of adrenaline. And adrenaline is basically an emergency drug. When we will discuss its uses, we will come to note that most of the times it is used in emergencies only. Route is either IV, IM, subcutaneous, or endotracheal. It has rapid onset and it is metabolized by monoamine oxidase and COMT. These two enzymes will metabolize it. Now, third point to be discussed is systemic effects. What has its actions? What it does to the body? To begin with, we will discuss the cardiovascular effects. In cardiovascular, as we have already discussed, when beta 1 is stimulated, it will cause increase in heart rate. When beta 2 is stimulated, it will cause vasodilation and bronchodilation. But remember, beta 1 action is always more. It will cause increase in heart rate and increase in force of contraction also. Right. Third point is it will cause alpha 1 stimulation, which will cause vasoconstriction. At high doses, it will cause vasoconstriction also, and that will cause increase in diastolic BP. Number two is the respiratory effects. It will cause beta 2 stimulation to cause bronchodilation, and it decreases mucosal edema. Then we have the metabolic effects. It will cause glycogenolysis, and glycogenolysis will cause hyperglycemia. Then it will cause mydriasis in the eye, means pupillary dilation. Now, what are the uses of this thing? What are the uses of adrenaline? Means what are the situations in which we use ADR? ADR is an emergency drug. Most important is anaphylaxis. Anaphylaxis. Here, ADR is the drug of choice because it can prevent or it can be life-saving. It is life-saving. What is the dose and route? See, whenever we use IM or subcutaneous, although in anaphylaxis we use IM, IM route is preferred. What do we give? We use 1 is to 1000 concentration of ADR, and the dose is 0.5 mg or 0.5 ml, because the ampoule which contains this concentration, it has zero point 0.1 sorry 1 mg per ml of ADR. We give IM zero point 0.5 mg or zero point 0.5 ml of 1 is to 1000 of ADR. Right. Second is the cardiac arrest. See, very importantly, in cardiac arrest, we use ADR in a concentration of 1 is to 10,000. Why? Because we have to use IV bolus, IV route. When we use IV route, we cannot give this concentration 1 is to 1000. We always use 1 is to 10,000 concentration, right? So it is given IV in case of cardiac arrest. Very important. Then third is the severe asthma. We can use the same dose of ADR as anaphylaxis. Fourth is shock. Though we do not use ADR nowadays in management of shock. We have other drugs like noradrenaline and dobutamine. Right, so that is all about adrenaline. We have discussed a lot of points. First is the mechanism of action. Second is the route of administration. Right. Third is the systemic effects. And fourth is the uses of adrenaline in different scenarios. How do we use it? So that is all about adrenaline. Thank you so much for watching.